tell us mental health. How common are mental health for women when they're pregnant?
Well, in South Africa, the common mental disorders, which are depression and anxiety, are in fact much more common than in many other countries. If you look at the developed countries like the States and England and Canada, they have a rate of depression around pregnancy of between 10 and 15%. But in South Africa, we have a staggering 35 to 40% of women who are experiencing depression or anxiety during pregnancy or in that first year after birth. So that's about 1 in 3 women. It's almost double the rate that you get in the developed countries of the world.
But what causes depression for the women after giving birth?
Well, the causes of depression are multiple. And we think that the rate is so much higher here in South Africa because women are facing multiple stresses, multiple risk factors at the same time that makes them particularly vulnerable to experiencing depression and anxiety. And these risk factors relate very closely to poverty, to violence, to things like HIV infection. Adolescents, teenagers are doubly at risk than non-teenagers. And a whole host of other factors that make our women more vulnerable. A lot of our women are facing trauma on an ongoing basis from childhood through into adulthood. And the fact that this is ongoing places them at high risk. And I think it's important to note that it's not just after pregnancy, it's also during pregnancy that we can detect these problems, both depression and anxiety, which are the common problems.
But what are the features of these mental health problems?
Well, depression and anxiety often presents like each other, so there's a little bit of overlap in features. And I think we obviously know that it affects mood. So people might be feeling very low about themselves, about their future, about the outside world, very tearful, crying, or incredibly worried and anxious about things that might not be that threatening. So one's mood is affected, but also one's thinking and thoughts are affected. So one's thinking about oneself, what one should do, how one should overcome problems, how one can sort out different priorities, different courses of action. All of that thinking and planning becomes very profoundly affected by anxiety and depression. And when you treat anxiety and depression, a lot of those things become much more easy for people. So it's also important to realize that depression and anxiety can affect one physically. And in fact can cause all sorts of changes with appetite and sleep and can even impact on the pregnancy itself.